You know, healthcare today, it's navigating some really immense complexity. We're talking relentless financial pressures, rapidly shifting demographics, evolving patient expectations, and these brand new care delivery models popping up seemingly every week. It really feels like an era of fundamental reinvention. So this brings up a truly intriguing question. Who is best positioned to lead through all of this?
That's a critical question, absolutely. To really meet this moment, the leaders at the helm, the CEOs, they need to guide their organizations through pretty significant transformation. They have to balance, achieving their core mission, patient care, with maintaining strong financial margins. It's a delicate dance.
You've perfectly framed that core challenge there, mission versus margin.
Yeah.
And it really makes you think, who is best equipped to lead in such a demanding environment? Which brings us to today's, well, fascinating idea that the next generation of top leaders in healthcare might actually be physicians, stepping directly into the CEO role. It's a surprising trajectory when you first consider it, isn't it?
It absolutely is. And our deep dive today is really all about exploring why physicians are increasingly eager to step into these enterprise leadership roles. We'll uncover the unique strengths they bring from their clinical backgrounds, and perhaps most importantly, what emerging pathways are helping them bridge that critical gap. Moving from leading patient care to leading entire complex companies, it's about how they can truly achieve both that vital mission and margin.
Right. And our insights today, they come from a brilliant collaborative article from McKinsey. They pulled together data from their physician leadership survey, in-depth interviews with healthcare CEOs, both physician and non-physician, as well as insights from top executive recruiters and CEO coaches. It's a remarkably comprehensive look at this evolving landscape. Okay, let's unpack this.
Well, what's genuinely fascinating here is the sheer ambition among physicians to expand their influence. The McKinsey Physician Leadership Survey found that more than half of physician leaders cited a desire to broaden their impact on patients. As a top motivator for expanding their leadership mandate, this isn't just about, professional advancement. It's a profound shift in how they envision care, moving from healing one patient at a time to influencing health for entire populations.
That's a really unique driver, isn't it, when you consider the CEO role, which inherently has that unmatched ability to shape an entire enterprise's direction and impact patient outcomes at scale. Well, it's not surprising that many physicians aspire to lead from that top seat. In fact, almost 60% of surveyed U.S. physician leaders expressed a direct interest in becoming a CEO.
Yeah, that 60% figure is striking, especially when you realize that currently only about 15% of healthcare CEOs in the United States actually come from clinical backgrounds. So this significant gap, it raises a really consequential question for the future of healthcare. How do we harness this clear aspiration so that the next generation of physician CEOs can successfully deliver both outstanding health outcomes and robust enterprise performance?
Okay, so the ambition is clearly there. But if so many physicians are ready to step up, what are the practical barriers holding them back from making that leap? Our sources point to some clear challenges. What did they find were the top hurdles?
Well, the top two self-reported hurdles for physicians transitioning into these broader leadership positions are skills gaps and perception barriers. We're talking 60% citing skills gaps and a full 52% pointing to negative external perceptions about physicians' business or leadership acumen. That makes a lot of sense when you think about their training. I mean, many physicians enter the workforce in their 30s after years and years of intensive medical training, often with, limited exposure to the nuts and bolts of business practices. Their non-clinical peers, by contrast, have typically spent years working with budgets, developing strategic experience, leading diverse teams in a corporate setting.
Exactly. And this limited business fluency, according to the survey, it results in a kind of self-perpetuating cycle. Physicians themselves acknowledge gaps in financial, strategic, market-based knowledge. Then CEOs and other executives voice concerns about this very lack of business acumen, which can restrict opportunities for physicians, and in turn, that hinders their skill development even further. So it becomes a catch-22 situation. This often leaves many physicians stuck in what are primarily clinical leadership roles, even when they possess the capacity and, frankly, the aspiration to lead far beyond the clinical realm. There's also this fascinating perception gap regarding leadership skills. Physicians themselves, they report high confidence in their operational excellence, their ability to lead large teams, their strategic expertise.
Right. But then on the other hand, the CEOs, physician coaches, and executive recruiters that McKinsey spoke to, they often cite these very same leadership skills as areas that physicians need to, well, round out in their profiles. This difference in perception, it can mean physicians miss opportunities, and CEOs remain concerned about their readiness for those non-clinical enterprise-wide roles. Closing that gap, as the courses point out, truly requires intentional, structured leadership training, much like how physicians approach their rigorous clinical training.
Hmm. This raises an important question, though. What about the instincts physicians develop through years of medical training? While they're absolutely essential for high-quality patient care, these can actually be, well, a double-edged sword when applied to enterprise leadership. The goal, it seems, is to harness them appropriately, to create what McKinsey calls bilingual physicians, those fluent across both the clinical and the business domains of healthcare leadership.
That bilingual concept is absolutely key. Take primum non nocere, right? First, do no harm. It's fundamental to the physician ethos, vital for patient care. But applying that same level of extreme risk aversion to complex business contexts, that can be incredibly restrictive. Strategy, at its core, often involves calculated risk-taking, bold, decisive action.
Yeah, but it makes you wonder, doesn't it? That deeply ingrained low-risk mindset so critical in the operating room. How does it fare in the boardroom where bold, often risky, strategic bets are, well, the norm?
It's a real shift. One physician CEO actually recounted how he had to make a conscious mental shift from needing to be, quote, right 99% of the time in a clinical setting to being comfortable with being right 75% of the time in business. It's a different calculus. And once he made that mental shift, he realized his clinical experience of making decisions under uncertainty, like triaging multiple critical patients in an ER or making a diagnosis with incomplete information that actually became a significant strength. He learned to rapidly assess complex, evolving situations, weigh probabilities, commit to a path forward, even without all the data, which really mirrors the volatile, ambiguous world of strategic business decisions.
That a powerful reframe, really
Mm.
powerful. And the duality of clinical training, it also shows up in that deeply ingrained hierarchy. Well, top-down authority is absolutely essential in life or death moments in a hospital. In other scenarios, that rigid structure can actually impede physicians from challenging the status quo, innovating, taking broader ownership to solve problems across an organization.
Yes, exactly. When physicians adhere too strictly to hierarchy and don't speak up, their valuable strengths like profound curiosity, incisive problem solving, and aptitude for lifelong learning, those often go unrecognized. Unlearning this hierarchical mindset allows them to showcase these qualities, qualities which many CEOs now see as crucial physician superpowers that can ease the path to the top jobs.
Superpowers. I love that term. And the sources give a fantastic example of an intensivist who became a CEO.
Yeah.
As an intensivist, this physician was responsible for ICU patients with multiple, often simultaneously critical conditions, each competing for clinical priority, requiring input from many specialists. His role wasn't to be an expert in every single condition, but to interpret recommendations, weigh complex trade-offs, make incredibly timely decisions under pressure. Now, as a CEO, he relies on this variability to empower his team to handle the details, while he zeroes in on the critical cross-functional issues, issues that demand his unique ability to sort of calibrate across the entire enterprise.
Those examples truly highlight how individual actions and, importantly, mindset shifts are crucial. The path to CEO isn't a simple checklist, obviously, but it involves cultivating these unique mindsets and behaviors. Our sources share two fascinating examples of physician journeys. One physician, he pioneered new surgical techniques, collaborated externally, scaled a new clinical subspecialty, which directly propelled him into clinical leadership and eventually the CEO role. And he actively cultivated mentors, consciously evolved his group of mentors as new challenges arose.
Smart.
And the other example, a physician CEO who deliberately stepped fully outside the clinical domain early in his career. He tested the waters with a business internship, which, kind of unexpectedly, led to an opportunity in government. That broader experience then opened doors to private health insurance, health tech, even investing. Along the way, he proactively deepened his understanding of strategy, policy, finance through direct, hands-on experience. He took career-defining risks, saying yes to roles others might decline, moved laterally and diagonally across sectors and functions, consciously assembling this truly diverse array of experiences. And for both of these CEOs, their unique mindsets profoundly shaped their journeys. They remained grounded in care delivery while consistently demonstrating their ability to bridge the clinical and corporate worlds. They shared a remarkable appetite for lifelong learning, a strong belief in their inherent capacity to adapt. For aspiring physician leaders, the path to success is ultimately about achieving patient impact at scale, not just the title itself. It really begins with an honest, humble assessment of their own strengths and gaps, actively seeking candid feedback from both champions and skeptics to identify their endowed strengths, their natural superpowers, and of course, areas for growth.
That's a great point, and it's not just about individual transformation, is it? Institutional commitment is also vital. Historically, many healthcare institutions have elevated physicians to clinical leadership roles, like chief medical officer, but typically haven't considered these as direct pathways in the CEO succession pipeline. Sometimes, these roles might even be seen as more symbolic than truly having purview over the institution's core value drivers.
Mhm. However, the interviews suggest a growing number of boards and executives are indeed recognizing physicians' CEO ambitions. They are intentionally considering pathways to support their transition from clinical practice to enterprise-wide leadership. To truly accelerate this, healthcare organizations can build what the report calls leadership factories, intentional, well-resourced systems that identify, develop, and elevate talent from within through structured, longitudinal pathways.
Right, these leadership factories. And a critical first step in building them is clearly defining what enterprise leadership truly looks like for physicians, including the foundational mindsets and behaviors that shape them. When organizations actively help physicians adopt these crucial mindsets early on, they can truly catalyze the development of new skills, knowledge, experiences, paving robust new pathways to the CEO role. Ultimately, it's about building a system that continually produces a deep bench of adaptable, enterprise-ready leaders.
And this systemic approach is particularly important right now. The healthcare sector has really reached a defining moment where complex clinical change management, comprehensive care model transformation, and deeply patient-centric personalized medicine. These will be the key differentiators for success. Physician CEOs are, arguably, uniquely suited to guide organizations through these precise challenges.
Okay, so to kind of recap our deep dive today, healthcare is truly at an inflection point where physician CEOs seem uniquely suited to guide organizations through complex clinical change, profound care model transformation, and that big shift toward deeply patient-centric care. For many physicians, enterprise leadership isn't just about getting a title. It's about profoundly scaling their impact, moving from improving care for one patient to influencing health for entire populations.
Yeah, and realizing this sweeping vision requires more than just individual ambition. It truly demands a clear, deliberate path forward, involving both that personal transformation we talked about and a strong institutional commitment. A commitment to develop these crucial bilingual leaders.
Right. And as we wrap up today's deep dive, here's a final thought for you, our listeners, to ponder. If specialized, deeply experienced professionals like physicians can retool their foundational instincts and mindsets to excel in completely new leadership domains, what hidden superpowers might you discover in your own core expertise if you deliberately sought to apply them in a radically new context?